Hi everyone, back at you here. Today we're in a different setting. We're in Dr. Alisha's office, which is just off of Rancho California Road. And today our topic is blood work. So we're going live on 2 streams again. So this is for Dr. Alisha's Facebook page. Hi over there. My name is PMFA, and I'm owner of Artisan's Palette and the blog site called I Am a Clean Eater. For my tribe over here, Dr. Alisha and I have been talking for the past 3 months, and this is our 4th live video. Can you believe it's already been 4 months? It's crazy. And we are going through today, and we're going to be talking about blood work. The first 3 videos we talked about were all about hormones. We had 3 really in-depth conversations on that. And if you need to watch those again, if you missed them on our live, scroll down the page through Artisan's Palette. But you can also, on the IamACleanEater.com website, subscribe to the YouTube channel, and you'll see all the videos there. Okay, so Dr. Alisha, thank you for hosting me today.
Yeah.
I appreciate this.
Thank you.
So we're talking about blood work, and I'm so into this right now, okay, because I feel like so many people need to have a proper benchmark before they can really assess where they're at, right? So most people will go to a general practitioner, and every once a year, maybe once every 2 years, you do a blood panel.
Yep.
Let's start there, because what is that blood panel and what is that telling us? And then we'll go through and start to talk about what you do, what's different from that.
Perfect. So when you go to your primary care's office, often they're going to, and it's really going to vary on the doctor.
Okay.
So I would say generally they're going to want to look at your cholesterol.
Okay.
They're going to want to look at your blood sugar. They're going to maybe not. They would probably do a TSH.
For your thyroid, which is not the right test.
Yeah. Exactly.
Okay.
So we'll talk more about that. A CBC, a complete blood count. That's what CBC stands for. And then a comprehensive metabolic panel, looking at your liver, your kidneys, electrolytes.
Okay.
And I would say that pretty much comprises the bulk of what that is. I want to throw in something interesting. Just yesterday, I have a longtime patient, and she ended up going to, I believe, her other doctor to try to get the blood work done. Okay. She's in an HMO.
Okay.
Well, the doctor did not want to do any blood work for her because he said, you don't really, like, what's the point? Like, you don't have symptoms.
Oh my.
And that's where I said it depends on the doctor and what their beliefs are, because he just thought, so when she told me she did, she's like, well, I'm going to brush up on some stuff. Like, oh yeah, wink, wink. Right. But I was just astounded and so disappointed. And that's disease care versus health care.
Yes, I totally understand. So, but when you go for a panel with your regular GP, with what you just said, there would also be different tests that they would run for males versus females, correct?
Maybe not.
Really?
Because they may look at a postmenopausal female and be like, well, why should I test your hormones? I know that they're low. If the man isn't complaining of low libido or erectile dysfunction in their mind, unless they're a progressive doctor, they may say, well, what's the point of testing your testosterone?
Okay. And does this cost more? Is that why they're so, because I know my doctor said, well, we could test for your D3, but I'm going to guess that you're low. I've been supplementing for D3 for years, so I already knew. But he was like, but you have to pay extra. So what is that? How does that fit into all of this?
Is that on a PPO or an HMO?
PPO.
So that's the hard part. So generally with one of the, I think, recent healthcare changes is that I believe, don't quote me, that it is mandated to have some preventative coverage.
Okay.
And I think under that preventative coverage outlet is some basic labs.
Okay.
At least done once a year that your insurance in theory should cover for you. Everyone's insurance though is different to say, well, what they think that you should have.
Mm-hmm.
And that's a whole other side object, because I'm like, when did a company get to determine?
Yes,
like,
this is so crazy.
You know,
yes, I totally
how
agree
about
with you.
our relationship
Yes.
and what
Yes.
we think is, you know,
going to work for the patient, which in this case would be me. And
yeah.
I want to have these things, but a lot of times I don't feel like the patient knows what they can ask for.
Yes, and so
right, that's part of the problem.
It is. So
yeah.
Oftentimes I'm telling my patients, call your insurance. Do you have 100% coverage, or do you have to pay 20%? Mm-hmm. Now, when it comes to the nuances, sometimes there are certain codes that may say, oh yeah, we'll go ahead and pay for the vitamin D if maybe your mom had osteoporosis.
I see.
But because I don't work with insurance companies, I don't know those things. Sometimes those primary cares can push things through,
okay.
depending on the coding that they use.
Okay, got it. All right, so you're going to have some sort of, basic information through a blood test to go through your general practitioner and give you some sort of information. And then what about the labs that they're using?
So often they're going to be sending you to Quest or LabCorp, mm-hmm. which are fine, reputable, good labs.
Okay.
By the way, if you want, I can turn this on low so it's not so high, or the fan if we get too warm.
Okay, yeah, I'm fine right now.
Good.
Okay.
So generally, the doctor will send you to Quest or LabCorp, which they do have. This isn't even another side thing.
Uh-oh.
So when it comes to pricing,
mm-hmm.
There is drastic differences in pricing. So, and I feel like I should almost be careful what I say. So I have an account with Quest.
Mm-hmm.
They give me a discount.
Mm-hmm.
Let's pretend you did not have insurance.
Okay.
And you just walk in on the street and you're like, I want to get XYZ.
Mm-hmm.
Or maybe on the test order that I give you, I write, you know what, I want her to be billed. That test could be thousands.
Okay.
Compared to maybe what I would say would be in the couple hundred.
Okay.
I think I remember being first shocked when one of my patients had to pay for her vitamin D because her insurance didn't pay for it.
Okay.
And they billed her, and I guess I'm not saying a lab name, so it's okay. They billed her like $200
just for the number for her D3
for a vitamin D, which is
Whoa.
like a $30 test. And they billed her, and I was just like, I was dying inside. Yeah. Because innately I just treat my patients' finances as if they were my own.
Sure.
Because I'm just thinking like, oh, that's rough.
Yeah.
So
the charge is per test?
It is.
I see. Okay, so it's not like we come and say, okay, now I want to do my labs with you. Not instead of the doctor, because you're already, if you have insurance, you're paying for that anyway. So it's part of your treatment plan or just part of your services. So it's not instead of, because I like this idea of being able to go somewhere else, get more of an in-depth panel, which is, I'm assuming, is why we would come to you,
right.
And what we would do, and then compare and then use that as a benchmark and come back maybe in 6 months or 12 months and then get another one and compare it with what we've done before, right? But what you're telling me is if we're asking for more tests, each test has its own price tag associated with it.
Right.
How does that compare to each lab?
That's a good question. Every lab does have differences in their pricing, so it's hard to kind of say. If I were to say, okay, on a cash basis, let's say you didn't have insurance coverage, what would somebody be paying? Probably with my discount, it's in the realm of $200.
Okay.
Give or take a little bit.
For a pretty complete panel.
Fairly complete.
Okay.
And, but when they have insurance and depending on their benefits, often I have plenty of patients who are like, oh yeah, my insurance paid for the labs that you ordered.
Okay.
So that's kind of another kind of discussion of often I will order things on somebody's insurance panel.
Okay.
If they already know that they have good lab benefits and that
Okay.
they're not going to get stuck with a atrocious bill.
Okay. So that's something that you would talk to me about, so we would know this is what my insurance covers.
Right.
And these are the things that are important to me to get tested, worthwhile to get tested, and not something that is generally tested or given to you through a GP.
Yes.
Correct?
Yeah.
Okay.
Yep.
So now we understand kind of, and I want to remind everybody, if you're watching live, and you have questions, please go ahead and ask those questions, because we're live now and we can answer them for you.
Yeah, please. I don't think we have any
please
yet.
don't hesitate to go ahead and ask these questions. So moving right along now, let's use me as the patient.
Perfect.
Okay. So I come in, I book an appointment with you, and we have a consultation, right? We're discussing what are some of my goals, health goals.
Yep.
What do I want to test for? By all accounts, I feel healthy and everything's good. I want to keep it that way. So somebody like me that's coming in that really doesn't have, knock on wood, a history with issues, what would be the first step? What would be the recommendation of the panel that would be different than what I get from my GP?
So with your GP, we talked about TSH. So that stands for thyroid stimulating hormone. So when you look this up on Dr. Google, you would learn that TSH is actually a hormone made in the pituitary gland. I'm pointing theoretically to my pituitary gland. It's in your brain, in your head. And that's telling the thyroid stimulating hormone, telling the thyroid to make free T3 and free T4. What I find often is that most primary care doctors will order just a TSH alone,
right,
and base your saying, oh, Pia, your TSH is normal,
right,
your thyroid is good. But I'm like, how can you really do that? That's actually just testing. There is a feedback loop. And so I think that you really need that free T3, free T4 to measure what is your thyroid actually hormone producing.
Right. What about reverse T3?
Reverse T3 is a great question. That is definitely not on a standard GP test. And
which is usually where the problem is with thyroid, right?
It can be. And stress, chronic infections can raise that. And for those of you who don't know what reverse T3 is, it's basically, I like to kind of use the analogy like a key. And so if you have your front door key, AKA your T3, and it unlocks the door, that's good. But reverse T3, it fits in there, but it doesn't open the door. It doesn't unlock those receptors, and so that can cause problems. I also sorry, it's been a long day. Also, I like to test thyroid antibodies.
Okay.
To make sure, because Hashimoto's is pretty prevalent, and you're not going to get an indication. You can often have a normal TSH, and you can even have normal T3 and normal T4 and still be having an antibody autoimmune response. So those are kind of the whole complete thyroid labs that I like to look at.
Okay. Now, when you base a recommendation to get a lab, do you base it on, well, here's a woman, she's in her 50s, this is kind of her medical history, no real problems with this, so these 10 things are what should be tested? Is that some sort of analysis that you do?
Yeah, I would say, and I do kind of find that I have some standard things, but it is going to vary depending on the chief complaints. So let's say, I always like to look at iron, and I do believe in yearly testing. Sorry, I'm going to kind of go off tangent a little bit. So you mentioned kind of like, yes, every year we should be getting blood work. So if you guys, audience to you guys, if you're not getting your blood work done, oh, hello.
Hi, everyone.
If you're not getting your blood work done every year, then you don't know what's going on. And I kind of was thinking the other day of when I got that email from that patient about how, how he was like, well, you're fine. You don't need blood work. And I was thinking, like, is this how somebody might end up later. I'm using an extreme example, but like with stage 4 cancer.
Oh, 100%. I was going to bring that up because how many times do I hear that, oh, I went to the doctor and everything was fine, and then 3 months later it's like, I don't know what happened, but I've got cancer. And you're like, huh? Didn't you just go and get your blood work? How did nothing show up with that? It's because they're not, it's just a real limited panel, correct?
Yes, and some things don't always show up, but if you're not testing, then like we don't even have a chance. So I think testing at least gives you a chance, especially if we're looking at an inflammatory marker. I like to look at something called high sensitivity CRP, C-reactive protein, to say, what's the level of inflammation? We know that inflammation, we say, is like the root cause of disease, and that's an important marker to be looking at.
And so really when we are just relying on our general practitioner to run these tests, that marker is not tested.
I would say most of the time it is not. You're correct.
Okay.
I went on a tangent. Yearly. That's right. So I was talking about yearly blood work. And then when I find something wrong, I'm retesting in a matter of 10 to 12 weeks.
Okay.
So whether it's low vitamin D, I don't want to go 6 months or a year, because I want to know, am I in the therapeutic range? And so if we find on that annual panel that there is a problem, I want to recheck. I want to intervene with treatments and then retest in a matter of 2-3 months. Now, does everyone do that? No. Life gets busy.
Right.
So sometimes then we end up at the 4 to 6 month range.
Right.
But at least that you're not waiting a whole year to be like, oh yeah, I was deficient years ago in vitamin D.
Yeah, and I never tested it again. In fact, I don't know if you read this. I didn't read all of it. I just kind of briefed it. But there's a new study from UCSD that just came out, I think it was this week or last week, on D3 levels. Basically saying, yeah, everybody is deficient in vitamin D3, and we were making recommendations, basically the medical community making recommendations to take like 5,000 IU, when most of the times if you're taking a supplement for D3, it's just 1,000 IU. It's not even close. So they were saying you need way more than that, and there is no such thing as D3 toxicity.
Interesting.
So they were saying even 40,000 IU.
Wow.
And they were basically, with the study, I don't have all the details, but you could definitely look it up. UCSD is just a recent one on D3, basically saying that vitamin D3 deficiencies are causing so many illnesses that we're going to find out more and more throughout the years that this is a big problem.
Yeah. So. Yeah, definitely. I mean, I think when I think of cancer, I'm like, that's, vitamin D is so important for our immune system, for our bones.
Yes.
And mental health. And
well, it's working at the cellular level. So everything at the cellular level requires one out of many, but D3 is definitely one of those ones that it needs.
Yeah.
Yeah, or that we need to supplement on.
Well, somebody has a question. What do you think of taking vitamin K with vitamin D? Wendy, great question. And yes, K2 is really great to help with the absorption of that. It's also great for your bones. So yes, and you carry vitamin D in your office.
Yeah.
Do you carry it with?
Yeah, I have one with D and one with K. So how I recommend this, and I don't know if you agree with me or not, but with vitamin K2, K carries calcium. It's such an important vitamin to be taking. To get K2 out of food, this is what I understand, you get it out of pasture meat, pasture eggs, like true pasture, okay, and pasture ghee, so things like that, okay? So those are the only things that I eat every day. Okay, I only eat pasture meat, I only eat pasture eggs, and I only eat pasture ghee. So that's one way that I feel I'm getting enough vitamin K2 through my diet. So I'm just supplementing individually on the vitamin D3. If you are not doing that, then yes, it's probably recommended to take D3 and K2 together.
Yeah.
Do you agree with that?
Yep, yeah, that sounds good.
Okay. So this panel now, going back to me as the patient. So I'm coming in. So we do an assessment. We've got like a 30-minute consultation that we're talking about, or is this longer?
For most of the time, I would say most people are motivated, since I am an out-of-network provider, so they're paying out of pocket. Most of the time, people are motivated to come see me when there's a problem. So I'd say most of the time it's an hour appointment, so we can discuss those problems. A few times when I talk to the patient before we schedule that, and I get the sense of there's no complaints, then yes, I break it down to a half hour and say, okay, let's break up your time.
Okay.
One other thing that came to mind is, so in the past, and I'm sure the audience can kind of chime in if you want, but what I find is that doctors will often just write their patients a letter and say, all your labs were normal.
Yes. Get that all the time. Yeah, no, nothing to worry about. Everything's in line. Go, okay, well, what does that mean? I don't know what you tested for. I don't know what that means in line. How old is the test that is being used, right? So it's like, we have no information.
Yes, and so I find that really problematic, because sometimes I will look at patients, their blood work that they brought in, and I'm like, did they say anything to you about, about the low whatever it is, or that your urine wasn't clean? No, they didn't say anything. And I'm like, that's a big problem. So when I'm going over somebody's blood work, I'm actually trying to educate them at the same time.
Perfect.
And so I'm almost going line by line to say, Pia, look at here, your cholesterol, our metaphoric lab here. Your cholesterol looks good. Your HDL, it's a little on the low side. We need to get that up. Your HDL is your good cholesterol. And so I'm trying to educate people so that then when they're not in my office, they kind of have an idea, like maybe that will stick. Not that they need to become a doctor, but I just think that
just being more involved in your health is so important, because it goes back to what we were saying before, which are these benchmarks that we set, right?
Yeah.
So how do we know to improve on something if we don't know what the range is when we come back and do another test in a year from now? So it's like, back to that cholesterol, and some of those numbers, it could just be like, oh, that's just your body functioning at that level. So that's okay. So that on the lower level for you, it's okay, because we've done 3 tests and you're all in line with that.
Yeah.
Correct?
Yep.
Yeah.
And so, so every doctor is a little bit different, but I just think, and I always think that you should be getting a copy of your labs. Like, people out there watching, do not let anyone just send you a note saying everything's normal. Always get the actual lab so that you can see those numbers for yourself. Because sometimes I even see that the lab, they'll have been told everything's fine. But when I look at the lab, it's even reported, oh, that was high, that was low. But to the doctor, it was just minor kind of insignificant.
Right.
And they're inundated. I mean, we have a shortage of primary care doctors, and I feel bad for them because they're seeing so many people. And so if something is minuscule, it might be really hard for them to say, okay, schedule an appointment, like, we need to dive into this, but I can't because my patient load.
Yeah, we're in a time, in my opinion, that it's so important for us to take control of our own health. So the more information that you have, and I loved what you said here, is if I come in with my existing blood work, you can help me go through it and then say, okay, let's improve on this. And then these would be the tests that I would recommend for you.
Yes.
And that just sounds very smart to me, because it's like, okay, I have one set, and that's one kind of benchmark for me. And now I'm going to go in and get further, more in-depth, testing, right?
Yeah. Well, and sometimes if somebody already knows that, thank you, Sherry. I'm glad you're finding it informative. Sometimes if people know that they're like, I will, if they know that they're going to be getting blood work, like maybe you have an appointment next month with your primary care doctor. Maybe you go every September, And what I do is if we were to say, yes, let's go ahead and meet. Let me find out what your needs are. Let me type up a letter. Dear doctor, we share a mutual patient. Could you please be so kind as to add these things to her upcoming order?
Oh, that's a great idea. Okay, that's awesome.
Then you go into your primary care because you're having your PAP, because I don't do that, or whatever it is. And then you say, hey, by the way, here's this letter. And then they may kind of balk at it like, oh, okay, well, I guess this other doctor wants, okay, fine, I'll do it. And so, and then depending on the insurance, especially if it's an HMO, then it has to be within them for it to get covered.
Okay. Okay, very interesting. So just talking about now, I think we all see the value in getting additional testing other than just what your general practitioner is offering. And now let's just go into just for a few minutes and talk about I just lost my train. It's a long day.
It's been a really long day. I know.
It's been a long day and I don't have my pen. We're in another setting. What was I going to say now? So sorry. I've just completely lost that track.
And I know. I had that.
Okay, well, let's do that.
Times.
Okay, memory.
Yeah.
What do we tell? Oh, that is what I was going to say, actually. That's what I was going to say. So if we have a specific area, like, okay, we're concerned about our gut or digestion or some form of elimination, or my brain is like, I'm getting tired or I'm dehydrated or whatever. What are some of those tests that can be done?
So when I think about fatigue, mental fatigue, vitamin B12 is a really important one.
Okay.
Just the patient that I had before we started this, poor young girl, but she was vegan for a while and vegetarian, and she wasn't supplementing with her vitamin B12. And we're talking like deficient, not just, so let me kind of preface this.
Okay.
So we titled this talk, Normal Labs. And a lot of times what I hear from patients is, hey, they said everything was normal. Everything was in range.
Yes.
Well, vitamin B12, the range is 300 to 1100. Anywhere within there, your doctor is going to probably say, you're normal, you're fine.
Okay.
Well, where should it really be? It should really be greater than 800. And I actually don't mind seeing it even flagged as high in the 1700s if somebody is supplementing.
Okay.
So the fatigued person, maybe they're a little bit foggy. So we're thinking about B12.
Okay.
We've already talked about vitamin D. I would want to look at hormones like progesterone. Progesterone is really important for our brain chemistry and memory. So that would be a good one. If I'm going to be looking at progesterone, I want to look at all of the hormones as well.
Perfect.
And I would probably say, yes, thyroid would come into that conversation. And maybe not if the person also said that they're kind of stressed or they're really tired. I'd want to look at cortisol.
Okay.
And I would say most of the time I'm wanting to look at all of these on most new patients.
Okay.
Because it's great to establish that baseline and
then move on from there, because if there's an elimination problem, then you can look at, well, let's do a stool test.
Yeah.
Right? Let's look at your gut, see if there's bacteria in the gut, and you can move forward from that, right? So your gut's kind of like a good benchmark first of what you want to do. Yeah, based on that conversation. So I know I'm signing up. So
yay, thank you.
I'm gonna get all this stuff done. I'm excited because I feel like now I'm in a place taking care of my own health, and just I don't feel comfortable going to that, checkup every year and then just getting a phone call saying, oh, that's all normal, you're in range, and I'm like, well, but I don't even understand that. So I encourage everybody to kind of get control of your own health as much as possible. We have these tools available to us. When we go through somebody like Dr. Alisha, the great thing is we're not going to get ripped off by a lab going by ourselves into a lab, right? Because I know several of my customers gone in and done their own blood work, and they've paid several hundred, if not more, just for that when it would be so much less just coming through you, right?
Yeah. Yep, that's a good point. And I always like to start off with that free 15-minute phone conversation with a prospective patient to kind of sort out, to say, okay, are you in an HMO? Are you in a PPO? Maybe you don't have insurance. So then we kind of have an idea of what that conversation is going to be like, what the finances are going to be like, etc.
Awesome. I love it. So we're going to close out here in the next minute. So if you guys have questions, can you please ask them now? We would love to answer your questions moving forward. So any last minute thoughts? Let's just look at our notes here and make sure we covered everything we wanted to cover.
Oh, okay. Another thing, autoimmune, we did kind of touch on that.
With the antibodies and the Hashimoto's and stuff, so you would test with that. Adrenals is another good one. We talked a little bit about that with the cortisol.
Nutrients, we talked about B12 and vitamin D. I like to look at a magnesium level because that is an important nutrient. I don't find it low in everybody, but there are some people.
Yeah.
And with so many people having hypertension, if you have high blood pressure, you definitely want to look at magnesium. So that's just one other nutrient. And iron, in the form of iron storage, a lab called ferritin. And that is really important, especially as menstruating females, because we lose blood and we lose our iron in our blood. And that's an important thing. And it's kind of like Goldilocks. Iron with ferritin, you don't want it too low, but you don't want it too high because it can be oxidative.
Right. What's your advice on, because it's hard for our systems to be taking iron, so what is your advice on the concept of taking copper? Because copper is just like vitamin K2 travels and it takes calcium to the places it wants to go.
Yeah.
Copper does the same thing with iron. So do you recommend supplementing with copper versus iron, or both of them, or more copper and then supplement maybe once a week with iron?
You know, that's gonna be tabled for another conversation because I am not I'm not kind of up on that copper thing. That might have gotten lost back. So yeah, I want to look at that later.
Okay, because copper is a great what do you call it? It's a mineral.
Yep.
It's a great mineral to supplement with, and it is something that's a little bit easier, more available, bioavailable for your body to, I think, if you're eating a lot of red meat, or not even a lot, just some red meat or spinach, the foods that are high in iron, then the copper generally will take iron to the right places in the body.
Yeah. One last thought. We have a question. Does B12 play with anxiety? Great question. Meaning, I'm wondering, maybe I'm gonna guess that like if B12 is low, can that cause anxiety? Maybe if you wouldn't mind if that, I generally think of, well, so the B vitamins, when you have B12, there's also folate, and often we actually test those together. And I think of anxiety more potentially with folate being the issue, not exactly B12, but often if you have low in one, sometimes, not always, you're low in other. So I'm thinking more of folate being at play with anxiety than B12.
Or maybe, oh, she's saying yes. Okay. So.
One last thing. So we all talked about these normal standard labs that any traditional lab would do. There are, and this might be another conversation, there are labs that do nutrient testing, where they are doing copper and zinc and all your vitamins. And so I don't run that as regularly because that is something that insurance generally does not cover. But if somebody is kind of really wanting to really know what's going on in their blood.
Yeah, that'll be me. I definitely want to have that test.
Yep.
Yeah.
So cool. We'll talk about
that. I'm there. I'm there. Okay, so it doesn't look like we have any more questions. Very good.
Yay.
So follow us. So we'll be back. We haven't set a date yet for September because you're going on vacation. Lucky you.
It's hard to call it a vacation.
Okay.
Yeah.
I thought you were going backpacking.
Yeah.
Okay.
But I'm starting to become anxious about it.
Oh.
I mean, living in a backpack and like carrying water and thinking about every ounce and
maybe you need a B12 shot.
Yes. But anyway,
that'll help you.
Yes, we will look at the calendar, and I'm hoping that we'll get back on our regular schedule of the third.
Right, third Tuesday of every month. So that is the projected date for September, which will be the third Tuesday in September, and we will have a topic for you. I think we've covered the blood. We don't have to do a part 2 on this one, right?
I agree.
So we'll have another topic available for you in September. So until then, thanks everybody for joining us. Thank you. We'll see you next time. Bye-bye.
Thanks. Bye.